The Breakfast Show 2021.
KBC English Service.
Good morning, my name is Julia Wanjiku. It's 23 minutes to 9. And this morning on The Big Conversation, our focus is on tuberculosis. Yesterday was World TB Day, a day set aside to raise public awareness about the health, social and economic consequences of TB, and also to step up efforts to end the global TB epidemic. TB remains one of the world's deadliest infectious diseases. This morning in studio, we are delighted to have Sarah Chandi, TB coordinator, Kibra Sub-county, letting us know about the interventions that have been taken to save lives in Kenya. Before we come to that, Sarah, let's talk about the drug-resistant TB. What exactly is this?
The drug-resistant TB is still tuberculosis transmitted the same way, but this time, this bacteria has now resisted the primary medications that we give when someone has TB. So we have now, it's a resistant strain of tuberculosis. So the presentation, the way the patient presents is the same. Everything, the symptoms are the same. But now this we are able to diagnose by doing the test that I had told you earlier on, the gene expert, which is able to check if you have a resistance. And there are also other tests that we usually do that is called a culture and DST that we do to be able to know if there's any resistance to any of the drugs that we use to treat TB. Yes.
1.5 million people have the drug-resistant TB. This, of course, is a burden also to the treatment of TB.
Yes.
So how is this treated?
Indeed, this is a burden, like you've said. We cannot talk about the treatment of the drug-resistant TB without first talking about the treatment for the drug-sensitive TB, the normal TB. So TB is treated for 6 months. You take medication for 6 months. We have divided this treatment phase into 2 phases. This is what we call the intensive phase, which you take 4 types of drugs that have been put together in one pill. So you take it for the first 2 months, then that is, we call it intensive phase. Then the continuation phase, you take it for four months, and for those 4 months, we now reduce the drugs to 2 types of drugs that you take. So the completion of treatment is done at 6 months. That's for the drug-sensitive TB. Now, when we come to drug-resistant TB, now once someone has the drug-resistant TB, they take treatment for 18 months. Yeah. So the type of treatment, we call it injection-free regimen, whereby they are taking a number of drugs. We also have divided into intensive phase and continuation phase. Intensive phase takes 6 months, and continuation phase takes 12 months. That becomes 18 months.
It used to be that if one had TB, treatment included going to the hospital every day to get a jab. Has this changed?
Yes, this has changed. There before, we used to treat the people who are being retreated for TB, and we used to, the injections are actually included. Whereby this intensive phase, part of the medication that you take injections for 56 days. That's close to 60 days, yeah? That's 56 days, that's 2 months. And then also for the drug-resistant TB, we also, the intensive phase, these 6 months were also inclusive of an injection that you would get daily for the 6 months. That has since changed. For the drug-sensitive TB, we no longer give the injections, and also for the drug-resistant TB, we are nowadays not giving the injection. We are on a regimen that we call injection-free regimen that you take for 18 months.
So for drug-sensitive TB is 6 months, for drug-resistant TB is 18 months. So the duration of this treatment, could that be the reason why we hear cases of people who do not follow through the treatment for the entire treatment period?
Taking treatment for some time can be challenging.
Yes.
Yes. So we know of people who are not even able to complete their 5-day course of antibiotic or 7-day course of antibiotic. So you can imagine taking treatment for a long period of 6 months, and you have to take it every day. Yeah, so that also poses as a challenge, because some of our patients, once they come to you, they are unwell, and of course the moment you put them on treatment, the response is usually you see the results in quite a very short time. So some of our clients, they will take treatment, and then once they feel okay and they begin to see it's actually a burden to take these drugs for the remainder of the time. So some usually drop, but just a small percentage of them usually drop. But we usually just continue to do what we call default tracing, whereby we trace them and bring them back on treatment. Every time they come for treatment, we just keep reminding them that you still have to take this treatment for this time, even if you feel well. That doesn't mean that the bacteria are dead. You have to continue taking the treatment for the said period, the 6-month period.
Can not taking medication throughout this period also expose one to getting the drug-resistant TB?
Yes. If you do not follow through the treatment regimen for the drug-sensitive TB, then you can end up getting the drug-resistant TB. Because now, when you don't take the treatment as required, you give the bacteria space to be able to reinvent itself. It can easily get used to this medication that you're giving, and now it becomes resistant to this medication, meaning that even if you take that medication, then it's not able to effectively destroy the bacteria. So this strain now reinvents itself and becomes resistant to this drug, so you will not be okay. Yeah, you will not get well.
Last week, Teresa Kaseva, director of the WHO's Global TB Program, said at a press conference that while we struggle to overcome the COVID-19 pandemic together, we should not neglect the millions of people suffering and dying from TB. Is COVID-19 pandemic derailing the efforts to reduce the burden of TB?
In 2019, before the pandemic, we were doing very well in terms of case finding. We were in Nairobi alone, we were able to register the confirmed cases of TB were around 12,000. But when the pandemic came in, we dropped by a 20% drop to around 9,000 cases. So that means that there are a number of people who would have accessed treatment to come for a diagnosis of TB that were not able to access. Why? Because now people were actually afraid to come to the hospitals. Then also there is the stigma around the issue of cough. The symptoms of COVID are somewhat similar to the symptoms of TB. And then again, it primarily affects the lung, just the same way COVID primarily affects the lung. So there were a lot of it. The coming up of the pandemic really affected our efforts to curb TB and to treat TB.
Let's talk about the similarities in treating or preventing the spread of COVID-19 and tuberculosis. And let's first listen to Health CAS Dr. Mercy Mwangangi.
To be alert to provide TB services, putting in mind that TB and COVID-19 more or less have the same symptoms, and therefore, in fact, the control of COVID-19 in Kenya would follow the same tangent as we aim to control TB infection, prevention, and control, diagnosis, contact tracing, and isolation. The same strategies we use for COVID-19, we utilize for TB. Those with respiratory challenges could potentially suffer the most if exposed to the COVID-19 virus. And we must bear this in mind as we mark this year's World Tuberculosis Day today. This year's theme of World TB Day calls for equitable access to prevention, treatment, and care in line with WHO's drive towards achieving universal health coverage. We have domesticated the theme to reflect Kenya's goals and targets. And our theme for Kenya is "The clock is ticking. It is time to end TB in Kenya."
Dr. Mercy Mwangangi, they are talking about how TB and COVID-19 can be handled the same way. So if one is having TB, those who have interacted with them should also be traced and isolated as they get treatment. I was asking you before the break, how come we never talked about treated TB or prevented it the way we are preventing COVID, like wearing masks and social distancing, because it's also an airborne disease, right? But you told me that there was a lot of stigma around wearing a mask for TB patients. But now that everyone is wearing a mask anyway, this then makes it easy or more manageable for people who have TB to follow these rules, right?
Earlier on, we were especially for the drug-resistant TB patients, we were encouraging them that as they come to the facility, we'd actually give them masks and tell them that, you know, because you can transmit. If you transmit the drug-resistant strain, the person actually gets the same drug-resistant strain. And so to prevent that, we were giving them masks and, of course, telling them about the cough etiquette, you know, don't cough out without covering your mouth and all. So we would give them masks, and what we realized is there was a lot of stigma around putting on a mask. And in fact, you would go somewhere and ask if someone entered, for example, a matatu and they're wearing a mask, nobody else will enter that matatu.
Yes.
Or even the crew of the matatu will actually ask you to step out, because people will actually not enter that matatu because you're actually wearing a mask. So there was a lot of stigma around putting on the masks. Up to now, even as we are dealing with the pandemic, we're still experiencing challenges with people wearing masks, yeah? Despite the fact that, yes, the uptake is way much better, yeah. So we already, that time we were having challenges. And so our patients, what they would do, they would come, and as they reach at the entrance of the facilities, when they would put on the mask. Or maybe as they just reach where the department where you are offering TB services is, where they wear the masks. So you see, this person has been transmitting, you know, along the way, despite the fact that you have given them every information about it, but because of the stigma that was surrounding the wearing of masks, then they would not put them.
The theme, as Dr. Mercy Mwangangi talked about earlier, of World TB that has been domesticated to reflect Kenya's goals and targets is the clock is ticking. What does it mean, and what interventions are being taken as a country to help stop the spread of TB?
One person who has TB has the potential of infecting between 15 to 20 people. And so the clock is ticking if there is nothing much that we are going to do about TB. So we need, as much as possible, for people to talk about TB, so that, you know, there's awareness creation. You know, the way COVID has been given, you know, every other person knows about COVID. So the same way, the clock is ticking, that if we do not if we do not talk about TB, if we do not create awareness, if we do not treat it the way it's supposed to be, the clock is ticking. Because despite the fact that TB in a TB, you know, it's curable, it can be treated, it can also kill if it's not treated in good time, and if it's not treated at all.
It can kill, and it indeed is one of the world's leading infectious killers. Does TB make one more vulnerable to COVID-19?
Well, yes, it can make you more vulnerable to COVID-19. Yeah, because of it affects the lungs. Yeah, yeah. And so and again, we had also talked about immunocompression. If immunosuppression, if your immunity is suppressed in any way, then your likeliness, you stand higher chances of getting COVID. Just the same way, if your immunity is compromised, you also stand a high chance of getting TB. Yes.
The WHO says systematic screening is critical to ensure we detect TB early. Could you explain this process to us?
Okay, so for systematic screening, what we had said earlier, what we do in the facilities, we have made sure that this screening of TB is being done in every department, every service delivery point in the facility. If you have whatever service that you have come for, we ensure that we screen you for TB just by asking the questions that are relevant for screening. But other than that, we have also come up with as Nairobi County have come, and the TB program, we have come out with innovations whereby we have a self-testing. We have a screening USSD code where you can do self-screening. And so it will, once you dial, can I
Yes.
give the number? You dial *371#. So when you dial, then it will now prompt you to do the next thing. It will ask you several questions. Are you coughing? So as you answer, you're actually self-screening yourself. Then if at all you are found to be, having maybe a symptom or the other, then you're directed to go to the nearest facility to go and have the test done, so that get to ascertain if you actually have TB or not. Then there's also a toll-free number that we have, which is 0800 72206. That also is, you can call that number, and then once you call that number, it's a TB helpline, which is also an innovation which we have in Nairobi, whereby when you call that number, the person who answers on that on the other side, they will take you through the screening. Then once you qualify, you fit the symptoms, and then you are directed to a facility, and they ensure that you have been actually handed over to someone who will take you through the testing.
Let's go back to treatment and talk about cost of treatment. 18 months for drug-resistant, 6 months for drug-sensitive TB. How expensive is it to treat TB?
It is expensive to treat TB. I am very conversant with the drug-resistant TB, which costs above 2.5 million for the entire course of treatment, because these are antibiotics, different types of antibiotics that
for one patient.
Yes, for one patient, for the drug-resistant TB. So you can see how expensive it is. And other than being expensive in terms of cost, it's also expensive for the patient because of the time that they spend coming to the facility. Because unlike the drug-sensitive TB, we require you to at least come to the facility during the intensive phase. Remember, I talked about the 2 phases of treatment. When you're starting treatment, we require you to come to the facility so that we can observe you as you take the treatment. So because we know that people are working and do not want to interrupt their day-to-day activities, for the intensive phase, we just require them to come to the facility at least once a week, whereby we monitor how they are taking the treatment. Then we encourage them to have someone at least at home who monitors how they are taking their treatment. So for 2 months, you are coming to the facility at least once a week. That is time, but that translates into, it has a cost implication. Now, for the for the continuation phase, we widen the appointment, so you come twice a month, every 2 weeks. And now when it comes to the drug-resistant TB, you have to come to the facility every day, because we cannot take a risk of you not taking, a client not taking their treatment.
This is drug-resistant?
Yes, for the drug resistance, you have to come to the facility every day.
For the 18 months?
Yes, we give you the drugs, we monitor you taking them.
So it is for the drug-sensitive TB that you come once a week during the intensive phase?
Yes, you come once a week. During the continuation phase, you come twice a week. I mean, twice a month.
So this is a huge cost even on time.
That's a huge cost even on time.
Are there interventions though, like NHIF, that at least maybe bring this cost lower or subsidize, especially in government facilities?
Okay, but in the government facilities, this treatment is given for free. Diagnosis, treatment given for free. And in fact, we even have implementing partners who support, give the patient a small amount of money to facilitate their coming to the facility every day. For the drug-resistant TB, it's at least a small amount that is usually given to the patient to facilitate their coming to the clinic every day throughout their course of treatment. Now, that's for the drug-resistant TB. But all this treatment in the public facilities is offered for free.
Whether drug-resistant or drug-sensitive.
And now, where NHIF comes in, if they require hospitalization, and especially for the drug-resistant TB, the National TB Program, usually when you get a drug-resistant TB, if they are not already registered with the National Hospital Insurance Fund, we ensure that among the things we require our patients to do is to enroll with the NHIF, and then for the period of the 2 years that this patient is going to be on treatment, 1.5 years, but they usually extend it, the National TB Program takes up the payment of the NHIF. In case this patient requires hospitalization, and at least they can cut the cost by NHIF paying for them.
What activities were there? What activities took place to mark the World TB Day?
Among the activities that took place, of course, we were not able to congregate.
Yes.
For obvious reasons because of the pandemic. But among the things that we continued to do, we continued our day-to-day screening in our facilities, and then the one that we really put emphasis on, we are screening our healthcare providers, because they also are at a risk of getting TB. And in the process of them offering services, sometimes we leave out ourselves, you know. So this time we were really concentrating in Nairobi, we were really concentrating on screening our healthcare providers and making sure that they are safe to offer services to the people. Other than that, we were also doing targeted screening, whereby we were going to certain specific areas where we know that the burden of TB is higher, especially in the informal settlements. We are actually doing some screening whereby we are going door to door, giving them information, and then other than giving them information, we are screening them and actually collecting samples from them to take to the labs that we are able to diagnose TB. Other things that we are also doing, that's just our day-to-day that we do. We have implementing partners also who have set up camps, screening tents in various places that are accessed by a number of people, like the Huduma centers, the railway stations, whereby random people who have just come for other services, they are able to be screened for TB.
Well, thank you very much, Sarah. That's Sarah Chandi, TB coordinator, Kibra Sub-county, who was our guest on the show this morning, letting us know the interventions that have been taken so far to save lives in Kenya in regards to TB, and of course, how to treat it, how it is diagnosed, and most importantly, how to prevent TB, because as teaching time saves
The
none.
Breakfast Show 2021.
KBC English Service.